on this episode of 2036, the podcast.
Emory has one of the top schools of medicine in the country, and we all benefited from being taught by those who came before us, and bringing up this next generation of physicians is so important. Obviously, medicine has changed. We know more about molecular aspects of medicine. There are more computers in use. But as I'm always telling the students, the essence of medicine is sitting in a room with a human being who needs your help and having a relationship with that one person. So yes, we need to learn about all the molecular features and all the new advances, but the most important thing is sitting there and connecting with that human being in front of you and trying your best to help that person each and every time.
Welcome to 2036, the podcast, Season 3. I'm Ken Carter, and today I'm here with David Frank. David Frank is the Christopher Brett Wolfe Chair in Hematology and Medical Oncology at the Winship Cancer Institute. He directs the Division of Hematology at Emory University School of Medicine's Department of Hematology and Medical Oncology. He also directs the Winship Innovation Initiative and is an advisor to the Morningside Center for Innovative and Affordable Medicine within the Woodruff Health Sciences Center. Board certified in medical oncology with a specialty in leukemia, Frank heads a translational research laboratory that has developed innovative therapeutics for cancer treatment. Welcome to the podcast.
Thank you. It's a pleasure to be here.
So you came to Emory from Dana-Farber Institute, accepting the inaugural Christopher Brett Wolfe Chair in Hematology and Medical Oncology at Winship Cancer Institute. John and Cammie Rice established the chair in memory of their son with the goal of accelerating translational cancer research. Can you talk a little bit about the chair, your relationship with the Rices, and what their support makes possible for research at Winship?
Well, thank you for asking about that. That chair has been one of the most meaningful things to me since my arrival here at Emory. So starting at the personal level, shortly after I arrived here, I had the privilege of meeting Cammie and John Rice, two spectacularly wonderful people. They are professionally accomplished, but even more importantly, just warm human beings. So that was inspirational just to meet them and hear their story. Obviously, my first question was, tell me about Christopher. And Christopher Brett Wolfe was a young man who unfortunately died way too early. But Christopher wanted to make life better for other individuals. And I have a picture of Christopher on the desk in my office, and I look at that picture each day, and I think, okay, let's try to use his inspiration to go out and do good things for people. The final part of that you alluded to also has to do with the funding that comes from that chair. So my laboratory works on developing new targeted therapies for people with cancer. Funding, of course, comes from federal grants largely, and we have to be kind of conservative with how we spend those funds. But the additional funding that comes from this chair allows us to be much more proactive and take high-risk, high-reward types of experiments to accelerate the approach of developing new treatments from the lab and bringing them to our patients in the clinic.
That's amazing. And so there are some things that you wouldn't be able to do without the money that comes from this chair.
Exactly. We're able to take risks. We're able to ask questions. Will this inhibitor of this protein work in ovarian cancer, for example, something that we might not have done otherwise? And those positive results have now spurred a clinical trial here at the Winship Cancer Institute for women with advanced ovarian cancer, something we would not have been able to do without these additional funds.
Now, you've spent your career caring for patients with leukemia and other blood conditions. How have medical approaches to treating leukemia changed over time?
Well, it's kind of interesting. When I was really a teenager, I got the idea that I wanted to be a physician. I wanted to take care of people with serious illnesses, and I wanted to help develop new treatments for people with cancer. So leukemia, I think, encapsulates those issues. Many of the treatments we're using today were developed many years ago. They need to be improved. On the other hand, our knowledge of the molecular abnormalities in a leukemia cell are way more advanced than they've ever been. And this is the time that we can use that knowledge to develop new treatments. So that was one of the things that excited me about coming to Emory, about opening my lab here, about seeing patients here, making new discoveries, and getting them from the lab to the clinic.
That's incredible. I'm sort of wondering, I'm thinking about you as a teenager, thinking about going into medicine. What's that connection from being a teenager to now in terms of what you've done? Have you done more than you would have imagined that you had as a teenager?
Well, it's kind of interesting. I think back to my interviews when I was interviewed for medical school or combined MD, PhD programs. And I was asked what I hope to be doing in 20 years. And I would say, well, I'd like to take care of patients with cancer. And I'd also like to run a laboratory trying to develop new treatments for people with cancer. And it amazes me every day that that's actually how things turned out. And that's what I do. And I can't imagine a more fulfilling career.
That's amazing. Now, your own research has developed new ways to target proteins that affect cell growth and health. Can you explain a little bit about how these discoveries have improved cancer treatments?
Well, it's interesting. Our laboratory studies the regulation of genes, and the proteins we study are called transcription factors. So in every cell in our body, we have the same DNA, the same blueprint, but how that blueprint is read differs from cell to cell, and that is controlled by these transcription factors. These proteins turn on and off genes in a highly synchronized way, kind of like a conductor of an orchestra. In a cancer cell, by contrast, these proteins become misregulated. And whereas they should only push a cell to divide briefly, in a cancer cell, those proteins are turned on all the time. So we're trying to understand how these proteins work normally, how they get misregulated in a cancer cell, and most importantly, how we can develop new drugs to target these to help people with cancer.
So what other kinds of treatments or discoveries have helped to accelerate your ability to help patients?
Well, again, I think this goes back to basic research in our labs and the labs of countless other investigators in the U.S. and around the world. We're discovering more and more mutations that distinguish a cancer cell from a normal cell. And then we're working together with both academic and industry partners to develop new drugs to target these abnormalities. So the goal is to kill the cancer cells without harming the normal cells. And that is kind of the holy grail in cancer therapy. And each day, I think we're making more and more progress towards that goal.
Winship Cancer Institute at Emory Midtown is designed to be a place where the patient is at the center of cancer care to be able to achieve the very best patient outcomes. Tell me a little bit about this facility and how it will improve patient care.
I'm very glad that you asked me about that, because that's really such a wonderful advance for Emory, for Winship, the people of Atlanta, and the people of the region, really. We have a wonderful clinical building at our Clifton Road site. But again, because of the growth of our patient volume, we just ran out of space there, and it became necessary to expand. But this was not done in a haphazard way. This was really done in the most thoughtful way, with patients at the center of the design process. So the building itself is spectacularly beautiful. When you pull up in the driveway, there's a beautiful sculpture. The entrance is warm and inviting. It's really an environment in which patients have told me they feel they're being well cared for. Similarly, our physicians and our allied staff feel that that facility is just beautiful and it's therapeutic in its architecture. But even more than that, and you alluded to this, the patient is at the center of the care that we give there. So the patient doesn't go around getting care. The care comes to the patient. Mm-hmm. This is such a forward-thinking care model that I think is now begun to be emulated in the design of cancer centers all around the country. So again, the physical space is beautiful, but the design, the form, and the function all fit together to deliver the best care to each of our patients, to make them feel that they're being given the best care, and actually to deliver that high-quality care.
Yeah, say a little more about how the care comes to the patient. That's an amazing thing.
Well, if you go into most cancer centers, and I've had the privilege of visiting most of the top centers in the country, you'll see the patient will first come in and go to a registration desk, and then go to a laboratory, and then go to radiology, and then go to an exam area, and then go to an infusion area, and so on and so forth. And that can be very taxing and confusing and stressful for a patient, all of which really has not only a negative psychological effect, but a negative medical effect as well. So we flip that model really on its head. The patient comes in, is brought into a beautiful space in which The care team will come, the phlebotomist will come and draw labs from the patient. The physician, the advanced practice provider, the nurse will come into the room and visit the patient there. If that patient needs to have infusions or transfusions, those will be administered in the same beautiful space. The space is set up to be comfortable and satisfying for the patient and also for any caregivers or visitors with the patient. Again, we're thinking of the patient and his or her surroundings. And that is delivered so beautifully. And again, you can just look at the building and say, well, this is a beautiful building, but it's the way that it works that makes it so spectacular. And again, the patients tell me again and again that they can't believe what a wonderful experience it is.
So I'm a psychologist by training, so I can understand the importance of doing what you can to reduce the stress and anxiety in that situation. And I can imagine that does that quite well.
I agree with you, and that is so important to the well-being of our patients, and I'm so glad we deliver that at such a high quality in this new facility.
Now, in addition to your research and clinical practice, you also teach. So I want to talk a little bit about your teaching. So what are your priorities for teaching new doctors?
Well, I'm glad that you brought that up as well. So Emory has one of the top schools of medicine in the country, and we all benefited from being taught by those who came before us, and bringing up this next generation of physicians is so important. Obviously, medicine has changed. We know more about molecular aspects of medicine. There are more computers in use. But as I'm always telling the students, the essence of medicine is sitting in a room with a human being who needs your help and having a relationship with that one person. So yes, we need to learn about all the molecular features and all the new advances, but the most important thing is sitting there and connecting with that human being in front of you and trying your best to help that person each and every time.
And so how does that reflect in the way that you teach? Like, what do you think is one of the most important ways to be able to communicate that to new doctors?
Well, I like to bring young physicians with me into the clinic at a very early stage of their education. Often they're focused on the medical details, but I really try to stress this is a person here who needs help, and we need to listen to what they're saying. We need to allow them to tell us their story. We need to be respectful to them, and in that way we can develop a therapeutic partnership to really help this person. So yes, I don't want to minimize the intellectual aspect of patient care, but if you can't relate to that human being in front of you, then I'm not sure we're making any advances. And I'll take that a step further. We hear about artificial intelligence and machine learning and so on. I don't believe computers will ever replace that one-on-one human being to human being interaction, and that's something we have to deliver to our patients every time.
I feel like some of the things that you're telling me is that you're really focusing on treating the whole person and also all the individual pieces of treating that whole person as well.
Yes, I agree with you. And I think one of the beauties of medicine is that you get the privilege of meeting so many people from different parts of the world, different experiences, and understanding them. And treating each person as an individual and understanding his or her story and making a relationship with them that will be therapeutic and beneficial to them, that I think is incredibly rewarding. And I want each of our young physicians, young students to understand that.
So you're often described by your patients as an excellent listener and communicator. Being able to put a patient at ease while clearly explaining their current condition is a really powerful skill. So how do you feel like you learned that? Like what in your background helped you to be a good listener?
Well, I was fortunate to have great mentors and people whom I admired, and I watched how they took care of people. And again, I'll have a student or a fellow with me in clinic, and it'll be a busy clinic, and nurses are coming in and out and asking questions and so on. But I always say to them as we're about to walk into a patient's room, it doesn't matter what else is going on. It doesn't matter how busy or hectic things are. When we go into that room, the only thing that we should be focused on is that human being in front of us. And I remind myself of that every day, every interaction I have. And hopefully all of the students who train with me get to see that too. And just treating each person as an individual, listening to his or her story, not rushing people as they tell you what is happening to them. I think those are very important lessons.
So what are some ways that you try to teach this skill to future generations of doctors?
I think it goes back to really selecting who becomes doctors. We often talk about grade point averages or test scores, but I focus on the human being to human being interaction. Is this someone who likes people? That really, these very simple things. Do you like people? Do you want to help people? Do you like taking care of people? I think those traits are so important because medicine should always be about that one-on-one interaction, and trying to stress that to our students and trainees is so important. And again, the total amount we need to learn today is much greater than it was 10 years or 20 years ago. But we can't ever forget that we're dealing with people, and we have to treat them that way in a respectful, positive, hopeful way. And that's what I always try to stress.
Now, understanding, treating, and possibly eradicating cancer is one of our campaign priorities at Emory. How close are we to this goal, you think?
I think we're making progress every day. So we need increased research, and that is going on. At a place like Emory, where research and discovery and advances is part and parcel of what we do, I think it's an optimal environment for that. The key thing, though, is taking those advances from the labs and not just writing a nice paper for a medical journal and not just giving a nice talk at a medical meeting, but being able to translate that from the laboratory to a clinical trial to try to learn how we can better treat our patients. And again, I think that Emory is perfectly positioned for that. We have incredibly close collaborations between our laboratory-based investigators and our clinicians. We have, in my laboratory, I'll often have our pure clinical colleagues come and listen to what we're advancing in the lab and discuss at a very early stage, how could we get this into a clinical trial? How could we optimize this treatment to help our patients? How can we learn the most from each patient so that we can make further advances down the road? So I think now is the time that our investments in research and patient care can really have a huge impact on trying to ultimately eradicate cancer.
And when thinking about eradicating and treating cancer, what areas of research do you feel like are most promising?
I think we need many aspects. So it goes from preventing cancer to begin with. And again, at a place like Emory, where we have a wonderful school of public health, where we look at large epidemiologic studies, we look at environmental exposures, things of that nature, to try to prevent cancer. I think trying to understand how to detect cancer early using radiographic and other techniques to detect cancer at its earliest stage to try to treat it and eradicate it at that point. And then again, the molecular advances that we're making, I think, will allow us to successfully treat even patients with advanced cancer. So this multi-layered approach in which we use knowledge from different domains and combine it, I think will ultimately be most fruitful.
And which kinds of cancers do you feel like we're closest to making big leaps around?
Well, it's interesting in that looking historically at cancer, years ago, one of the most difficult to treat cancers was testicular cancer. But then with the advance of discovering one particular drug, testicular cancer went from a very difficult cancer to a highly curable cancer. There are many examples of that where what we thought were the most intractable problems became very treatable once we made advances. So some of the most difficult cancers are, for example, pancreatic cancer or advanced ovarian cancer or brain tumors like glioblastoma. But I'm not pessimistic about the treatment of these cancers because our molecular understanding of them is advancing so rapidly. I'm very optimistic that we'll develop new and better treatments for all of these cancers really in the short term and the years ahead.
Now, in addition to research, patient care, and teaching, you also serve as director of the Winship Innovation Initiative and as an advisor to the Morningside Center for Innovative and Affordable Medicine within the Woodruff Health Sciences Center. Tell me a little bit about your duties in these roles.
Well, I'm glad that you brought those up, and there are two different aspects, both of which are important. So starting with the Morningside Center for Affordable and Innovative Care. So as someone once said to me, it's not a cure if people can't actually get it. So having medications that are affordable, that people can get of all walks of life in this country and frankly around the world is incredibly important. And the Morningside Center, which is headed by our former dean, Vikas Sukhatme, is really focused on that, using scientific innovation, but doing it in a way that can lead to affordable treatments. And it's a pleasure for me to bring my knowledge, both from the laboratory and the clinic, to help support that effort, which I think is so important in our country and around the world. In terms of innovation, again, Winship is on the forefront of that. And much of that comes from our academic labs that we as faculty members put forward. But coming from Boston, where I spent most of my career, there's a huge biotech and pharmaceutical industry there. And the ability for academic labs to partner with our industry counterparts is absolutely essential to advance great laboratory ideas to actual treatments that will get to our patients. So being able to coordinate academic research with industry and biotech support, I think will really leverage the expertise at Emory and at Winship to more rapidly develop treatments that will help patients all around the world.
I want to talk a little bit about affordability. So what kinds of things impact affordability for care, especially within cancer?
Well, there are a variety of aspects. So the new treatments being developed, many of them are incredibly expensive. And this gets into whole social dynamics and policies about how we pay for medications. Patients who have very strong insurance have no trouble getting these, and patients who don't often are left in a very difficult situation. I will say parenthetically that here at Emory and our colleagues at Winship, including pharmacists and nurses, go above and beyond to try to get the necessary medications for every single patient, no matter who he or she is. But trying to develop other types of medications, including drugs that have been developed for other purposes, or drugs already known to be safe in people, but maybe no longer have patent protection and are not being developed by companies, these can be impactful therapies at much lower costs that just need an alternate way to development. And the Morningside Center has really taken a leadership role in doing that. And I think that that's another wonderful aspect of the impact that Emory is having.
Thank you so much for your expertise and sharing what you've done here at Emory. To me, a lot of things you've been talking about treating the whole person and training faculty and doctors to do that as well, making sure that the treatments are affordable, is really important work that we do here at Emory. So I want to thank you for that and for joining us on the podcast.
Thank you for having me.
To learn more about 2036, Emory's campaign to transform the future, visit 2036.emory.edu.